Hi everyone, welcome to Raaonline. So today we are going to see about a case discussion which is going to be pertaining to the respiratory infection. So I will show you a case study and I will show you the systemic and local examination finding, and with that we will need to answer certain question. So we will go into today's topic now. So it is going to be an interesting session today. So let us go into the topic today. So this is our case. You have been provided with a case study. So here we are going to see a 25-year-old male who attended general medicine OPD with the complaints of headache, runny nose, fever and sore throat for the past 4 days, and there is no history of any breathing difficulty or chest discomfort, and examination showed the following finding, and the temperature is going to be 100.8 degree Fahrenheit and it's going to be an low grade fever, and pulse rate is 96 per minute and it's slightly high, and respiratory rate is 17 per minute, which is a normal respiratory rate, and SpO2 is going to be 98% at room air, and again it's going to be a normal finding, and auscultation respiratory system bilateral air entry was present and there is no wheeze and no crepitation, and local examination you are able to see an image. So in the image you are able to see the finding. So there is tonsillar enlargement and you are able to see the follicle enlargement, and we state this particular thing called influenza follicle, where there is going to be the enlargement of the pharyngeal lymphoid follicle, and in clinical examination we will be able to see this particular lesion in the oral cavity. So it's going to be seen in the pharyngeal examination, where we are going to see this particular bud-like structure in the pharyngeal examination, and we are going to have an influence over this particular infection. So you are able to see this kind of history, and there is no involvement of the lower respiratory tract, and you are able to see the lymphoid follicle, and that is going to be the enlargement of tonsillar area. So with this we will go into the diagnosis now. What receptor act as major attachment receptor for this particular virus? So you all know this particular infectious virus, they are going to affect the respiratory system, predominantly the upper respiratory, not lower. So we have studied about this particular infection in the past class, and you know this particular virus is going to get absorbed into the particular receptor called alpha 2 6 sialic acid receptor, and this receptor is seen in the upper respiratory tract. So that is why this particular infection is not involving the lower respiratory tract. So again patients with influenza can go for lower respiratory tract complicated infection. So there is going to be an bacterium which is going to cause an complicated damage in the patients who is going to suffer from the influenza. So we will see as we go through the particular case discussion.